This presentation is about Parkinson's disease. Parkinson's disease affects about 1.5 million people in the United States alone. Researchers believe that Parkinson's disease is linked to both genetics and environmental. However, it is believed that if you have a parent or sibling who has Parkinson's disease, you are 2 times more likely to develop the disease yourself. Parkinson's disease has an average onset age of 60 and is more common in men than in women. Parkinson's disease is a slowly progressing degenerative disease related to the brain's loss of the chemical dopamine, which controls coordinated muscle movement. This disease attacks the nerve cells in the brain that produce this chemical. Parkinson's disease gradually develops over time and may start with very little or barely noticeable symptoms. These symptoms may include tremors, little facial expressions, your arms may not swing when you walk, slurred speech, stiffness or slowing movement, trouble sleeping, walking and balance difficulties, and urgency for urination. Other symptoms of Parkinson's disease are loss of balance, forward or backward lean that can cause one to fall over, head shaking, voice and speech changes, such as voice becoming more soft, or poor enunciation, memory problems, handwriting changes or becomes smaller, depression, you feel fear or anxiety, confusion, drooling, skin problems such as dry skin that causes dandruff, and difficulties swallowing or chewing food. Now keep in mind that if you do have some of these symptoms, that does not mean that you have Parkinson's disease. Further testing needs to be done to rule out other conditions such as depression, aging, the use of antipsychotic drugs, and other degenerative disorders of the brain because they have similar symptoms to Parkinson's disease. Because Parkinson's disease is a neurological disease in the brain, symptoms of other conditions that affect the brain may be similar. For the correct diagnosis of the correct disease to be done, it is important to get to your doctor as soon as possible so the correct tests can be done. To be diagnosed with Parkinson's disease, you will undergo a thorough medical history evaluation, neurological examinations, a CT or CAT scan, or an MRI, blood tests to rule out other diseases or causes for the symptoms. They will check for signs of a stroke and check medication tests to see if that helps with the symptoms. Because Parkinson's disease is caused by the malfunction and death of neurons within the brain, the disease has no cure. However, there are a few things that have been found to help treat the symptoms of Parkinson's disease. The most common form of treatment is medication. If the doctors and specialists are able to catch the disease early enough, the correct medications have been known to help slow the progression of the symptoms of this disease. Being able to control the disease as soon as possible, or as soon as the patient has been diagnosed, is vital to the patient's long-term success. Another way that a patient can help the effects of Parkinson's disease is by a lifestyle change. This change may be something as small as adding regular exercise into their daily routine, as well as reducing stress. We all know that adding more or adding any exercise into one's daily routine may be easier said than done, and the same goes for reducing stress. For some patients, medication and physical measures that are taken may not be enough for them to attain necessary relief. In this case, sophisticated brain surgery procedures, including deep brain stimulation, can be provided for the patient. Deep brain stimulation involves the implantation of electrodes in the brain that electrically stimulate target areas. Some patients are fortunate enough that after undergoing deep brain stimulation, they are able to cut back on their medications by about 50% or more, and they even see long-lasting progress in their Parkinson's disease symptoms. Now, as stated before, Parkinson's disease is not a curable disease, so these are treatments that will only help the symptoms not cure the disease. And this is just a list of where I have gotten my information.